This is the book that's come out that Dr. Filtzer actually wrote his study results in. And it actually says that this water has shown to help the body fight stress better. So what is it that our body needs that Enagic is able to provide?
Well, particularly the two things that I think are the most profound ones are antioxidant, because as a free radical scavenger, it is extremely important, both a direct antioxidant and the SOD antioxidant effect, and then the anti-inflammatory. I mean, the anti-inflammatory is also quite profound. And I think we're missing the boat if we don't keep on studying that effect, because it's easy to do. And I think, look at how many millions of people have rheumatoid arthritis. I mean, it's millions in Western culture. And what do we do for that? Anti-inflammatory drugs, some of them terribly powerful and side effects. And here you have something that if you drink that every single day, it is very reasonable to expect a beneficial effect in your condition. Now, we're not saying it's going to cure it, but what we're saying is it's more better than not drinking it. Yeah.
Can you just tell us, Dr. Filtzer, how the right kind of water can increase red blood cell production in the body and increase delivery of oxygen and the removal of carbon dioxide, while the wrong kind of water can't? So how can the right kind of water do that? How is our Enagic machine able to do that? Because that's come out in your study result as well. And why can't normal water do that?
Well, normal water is still water. It's buffered to a certain pH, and that pH is very difficult to alter. The water is stable. It does not have any electric charge to speak of. It does have some clustering. All water does, which occurs in nanoseconds constantly in water. But it doesn't have an ORP that is significantly powerful to affect your electric balance, to produce ions that then, in fact, translate into the ability to alter the body's pH. And we know that it does, and that those are studies that are actually quite old. And you can actually treat chronic renal failure with ionized alkaline water. And the same thing with the anti-inflammatory and the antioxidant effect. Now, when we are subjected to stress of different varieties, it can be emotional stress, it can be physical stress, it can be all kinds of stress. What happens is we get a response. It's commonly referred to as a fight or flight response. And that is associated with an increased heartbeat. It's associated with all kinds of physiologic changes, among which is increased stimulation of the bone marrow to crank out red cells. And that is in response to the fact that when you're under stress, you need to do more oxygenation. You need to be able to send your muscles, oxygen to function and what have you. And the body, by using this stress response, provides up to a limited degree increased red cells, reduced inflammatory cells, and so on, to help you address that stress. And that's a primeval response. It happens in all living things, particularly mammals.
Doctor, when you say that, as the good thing with having the Enagic machine in your counter, in your home, and drinking that water regularly is increasing red cell production and oxygen distribution in your body, that then means that no matter what it is that your body is struggling with, it will always be able to help, because oxygen is something every cell in our body needs. Is that correct?
Precisely. Yes.
Yeah. So I've got a question here. With COVID, with everyone talking about how the COVID virus impacts the lungs or targets the lungs, one of the questions I have here is, can we say that Kangen water is so powerful, has powerful antioxidant to strengthen lung health? Is that an accurate thing to say? It's a question on Facebook.
Okay, that it would strengthen. I'm sorry. What?
That it has the ability to strengthen the lungs because of its antioxidant properties.
Well, I think that it's sort of a maintenance issue. You know, when you drink that water, the maintenance of your tissues, your body fluid, and all of that is made easier because it causes pH to be balanced. It causes to reduce inflammation and so on. So, in an indirect way, it is helpful to keep your lungs and every other organ system in good shape.
That's right. And this is just a follow-up to what you were mentioning earlier about high fluoride levels in your area of the world. Is it correct and accurate to say that the Kangen machine can remove about 50% of fluoride in tap water?
Yes,
Awesome.
yes, absolutely. Remember, it's a bivalent ion, so 50-50 goes to anode and cathode. So there you go. Yeah.
Okay. I'm just going to go through
Not yet.
some of the comments that's been sent to us here. So, hello, Charlene from Singapore. She's just sent us a good morning. And we've got Ray Tahora Tokmo from the Philippines. Thanks for joining us. Lai, you've said you've got Crohn's disease, and you said that you're sending water to your cancer friend with stage 4 cancer. It's improving. Awesome. I mean, I think, like what Dr. Filtzer said, without us diagnosing and claiming that we can cure specific illnesses, I think the most important thing to take note of is no matter what your body's struggling with, having the right kind of water, having water that actually boosts your immune system, having water that can fight stress means that it will always help no matter what you have or no matter what your body's struggling with.
Well, let me say the issue of cancer is always so emotionally charged and so on. And I get asked this all the time, how much should someone with cancer, or how much Kangen water should he drink? And my answer is always the same. He should drink as much as it possibly can, because it's good. It cannot hurt him. We don't have any hard data that there is a higher survival rate or that there's a longer survival rate because the studies haven't been done. But it is pretty reasonable to assume that when you drink a water like Kangen water, that it will help you in a variety of different ways, not necessarily specific to the replicating cancer cells, but to the whole being. You know, when you're on chemotherapy for cancer and you get sick to your stomach after they get done injecting you with whatever stuff they inject you with, and you vomit and you feel terrible. And then you take that same person and introduce them to Kangen water and have them drink the water before, in good amounts, before they get chemo, during and after. And they find that their nausea, their vomiting, their lousy feeling, their stressful thing is reduced and ameliorated. Well, that's a great effect. I mean, just, you got a bad hand to deal with, but on the other hand, this actually does help you deal with it. And so I'm all in favor of cancer patients drinking Kangen water. And it turns out now I have colleagues in very prestigious places in the United States, like Cleveland Clinic, for example, that give their patients Kangen water and encourage them to drink it for that very reason. Good hydration, because once you're chronically dehydrated, then you lose your sense of thirst. You lose your sense of well-being. And good hydration by itself, even if it weren't with Kangen water, good hydration is very important. And of course, again, the Kangen helps you without any question.
I love you said that, Doctor, because I do have a very dear person to me who's struggling with an issue similar to that. I think one of the fears with Kangen is when you have the knowledge of the amount of antioxidants in the water, the anti-inflammatory effects of the water, people start thinking twice about taking it when they have doctors that say, oh, you can't take any supplements or can't take any herbs, can't take any antioxidants. And I think that's where the problem comes in. You know, I have even, as I said, people who are dear to me that say, well, maybe I shouldn't be drinking this water while I'm going through treatment because I've just been told to stay away from supplements and herbs. Can you just explain a bit more? I mean, if it were you that were trying to explain to someone asking you that question, you know, they've been told to stay away from supplements and herbs. They've been told to stay away from antioxidants because it might impact their medications, specifically with cancer, chemotherapy.
Well, I tell you what, if you remind me, because I'm getting older than I thought I'd ever get, but make a long story short, I wrote a PowerPoint. I have a PowerPoint on that very issue, cancer and chemotherapy patients vis-a-vis Kangen water. And the entire antioxidant controversy has long been debunked as being bunk. It's not true. And I quote that there are at least 900 papers that assess the use of antioxidants on chemotherapy patients. And every one of those papers says it's perfectly safe to do. In fact, there are some antioxidants that have been studies in relationship to certain cancers, one being ovarian cancer, where the results are actually better when people take antioxidants and when they're not. And one of the most fascinating studies was that when it's related to compliance. The doctor will tell the patient, you must not drink any antioxidants, or you must not take any supplements. You must not do this, that, and the other thing, dietary-wise. And the researchers found, and this is an NIH study, that less than 12% of patients complied to their doctor's wishes. They live their life the way they want to. And just because they have cancer doesn't mean they're going to be making all these dramatic changes. So there was never any real compliance to that dictum in the first place. So the answer is chemo, antioxidant, go for it.
Thank you, doctor. I love that. This is from Shirlene, and she says, I know this session is about water, but as an example to one of our earlier questions, you mentioned about turmeric, which we all know is a good supplement, but not all turmeric is the same. Like those who get in the market for a curry is of course different. What is Dr. Filtzer's take on Enagic Ukon turmeric supplement? Does he have any experience with it? And if so, can he share his experience and knowledge with us? Are you okay to talk about this, Dr. Filtzer, despite us talking about water right now?
Well, no, I can talk about the turmeric, specifically the Ukon, for a bit. I'm not a huge expert on it, but I did go to Okinawa. I've seen firsthand what they do there and their farming methods, which are all 100% natural. There's no chemical stuff involved. The plants are healthy. The different strains of turmeric are variable. Certain time of the year when they're harvested, they yield more of the curcumin than others, and so on. And the method of being packaged, freeze-dried, etc., and put into a very digestible capsules are top rate and first rate. And quite frankly, being older now and having certain aches and pains, I find it to be an excellent product to treat inflammation. Every now and then I get a flare-up of my lower back, and then, I'm crippled, this and that. I take a handful of Ukon for several days. I don't take it every day, but for several days, and it helps me tremendously. And that's about all I can say about it. I'm not a great expert on it, but I also use it in curry.
That's right. That's right. Very different when you use it in curry, but I do agree. I've always said, use your food as your medicine and your medicine as your food. So that's right. Doctor, I'm just looking at your book here, and one of in the summary and conclusion on page 17, for those of you that have this book, you've mentioned here that when testing, when you've seen the results with exercise, it says here increased production of platelets with the consumption of Kangen water was also observed and suggests an improved readiness for stress-induced damage repair. So when you say stress-induced damage repair, is this applicable only for people that do long marathons and have, cramping pain or the inflammation in their system because of that? Or is it also with short exercises? If you can just elaborate a little bit
Well, it's
more.
all of the above. Look, we are constantly stressing ourselves in a variety of ways. For example, did you know that part of the reason we develop plaques on our arteries is called shear stress? Shear stress is when there's a bifurcation or a branching of an artery and eddy currents are produced from the flow alone, the rheology of how blood flows through a living human being. And that shear stress needs to be managed because it damages the endothelium and the lining. And we do that 24/7 in our bodies all the time because your heart keeps going and your blood vessels, they pump thousands of gallons of blood through your system every single day. So we live with stress. Some is easily managed, just we don't even notice it, and others takes a greater effort. And that's when you have people stressed, like with exercise, anxiety, whatever. Those stresses may be much bigger and may require and produce a larger response. That makes sense?
I love that. I love that you said that. I've learned diet, nutrition, and also aromatherapy. I have another client with Graves' disease, but there's a continuation to that. But not many doctors actually encourage patients to drink water. Is there a reason why water is something that's not normally recommended, Dr. Filtzer?
Well, I think that's a fundamental error that physicians are making. It's the idea that 70% of all people in the United States of America and Western Europe are chronically dehydrated. Mm-hmm. And the Europeans, particularly the Germans, they have done tremendous research on simple hydration. For example, in nursing homes in Germany, the patients have to have a specific gravity done on their urine 3 times a week to indicate their status of hydration. And there are penalties when these people, check out at, say, 1028 a concentration of their urine, which is profound dehydration. And you used to be, be that chronic nursing home smell from people who are dehydrated that have concentrated urine. And it's so important because it alters dramatically the fate of these people. They don't die as early. They have a better quality of life just by good hydration alone. So it's a complicated thing, but highly important. And why not do the best water while you're hydrating?
I love that.
I do know this, that the average person who starts drinking the water notices an effect virtually right away. And they particularly would say, Dave Carpenter, a friend of mine, a really good naturopath, he's one of my dearest friends, always used to start out when he talked about the water, they said, I'll tell you what, you want to talk about the water to me, which I've been dealing with and drinking with for 10 years, get a machine, borrow a machine, drink 3 liters of water a day for a month, and then sit down with me, and then I'll talk to you. Because then you'll have something to say to me, and you'll have something to say. Because if you say to me that you feel better and so on, I would expect that. And if you tell me otherwise, not so sure. See, I'm saying the proof is in the drinking, and I think it's generally a fairly rapid effect that's positive.
If you don't want to drink the water because you know how horrible it is, why would you bathe in the water? Our skin still absorbs the water. what would you say about the effect on the body by water that goes through the pores of our skin? Does it also, am I correct to assume that it also creates a massive imbalance in our system?
Yeah, I think you are. Particularly, chlorine is a real bad culprit. It gets absorbed through the skin, and it causes premature aging of skin. It's not a good thing. And depending upon where you live, the amount of chlorine in the water can be very heavy. So there is truth in saying that you ought to bathe in as clean water as you can possibly do. That's why I use the thing, what do you call it, the Anespa thing in my shower. And that's the one thing my wife absolutely tells me she likes about Kangen water is the Anespa. That she likes that better than drinking it. Makes a
Awesome.
difference.
Cool. I've got a question from Tamara here. And she says, how does the water help to correct or help allergies, asthma, and skin issues?
I'm going to say yes, but I'm going to say it with a qualification. I have no hardcore data other than anecdotal data. What people have told me and what people have experienced. And it makes sense that clearly, if we hydrate ourselves adequately and satisfactorily, many of these things like allergies and skin issues do improve. And I have certainly have a number of colleagues that are dermatologists who use the water on the skin. You can use beauty water on the skin, like an astringent, for example. And in my practice of wound care the last 10 years, I used gallons of 2.5 pH water to treat the most disgusting, dirty, infected wounds very effectively. I think, therefore, my conclusion is that it does indeed help allergies, asthma, and other skin issues because they are all interrelated. There are immune compromised system diseases.
Awesome. Thank you, doctor. I think another thing, Tamara, in naturopathy, in the study of naturopathy, and I think your homeopaths will say the same thing, that a lot of the issues with the skin is like a reflection of what your insides are. That's how we actually try and explain it. So the cleaner your system is, the cleaner your bowel is, the cleaner your skin becomes. So if we're healing our bowel, or we're sorry, I don't like to use the word healing, if we're actually helping our bowel rebuild itself, rejuvenate itself, then we're doing exactly the same thing to our skin. I hope that helps. There's another one here. When I had Crohn's, loose stool, I drank 3 days without medicine. So I'm assuming I drank water for 3 days without medicine. I see better stools, smooth as banana, that changed my life. If I can first, before I pass this on to Dr. Filtzer, just say, like, one of the things that I'm really careful of is telling people not to take their medications. There's a reason why medications are given by your doctor. I personally, when I was recommended to take steroids, I spoke to my doctor when I decided not to do it. I actually asked for a time to just trial other things first, and I managed my Crohn's with him despite me not going on steroids. And I would strongly suggest for any of you that are watching right now, if you've got any issues, any illnesses where you've got medications, the best way to actually manage it and rebuild your system with it is to work with your doctor. Not all of them are difficult doctors. And if you show that you will be in control and that you will, how to say, take responsibility and work with them,
Right.
they usually are willing to work with you. And as I said, my doctor gave me 6 months to trial something else, and that was how I got off without taking my steroids. But I'm happy that you had better stools without the medication. Dr. Filtzer, have you got a comment on this?
Well, first of all, you do know that Crohn's is a disease that has spontaneous remissions with no treatment whatsoever. I mean, that's well known fact. I also think that steroids are the reason that we've made so much progress in treating the immune disorders of the gut, like Remicade and all these other things that are immune modulators and not steroids, because the use of prolonged steroids has been so devastating. I mean, people lose their bone mass, people, get to look funny, they have moon face, they have all kinds of abnormalities, the skin gets thin. So the steroids might have aborted a bad flare-up, but to use them as a long haul has never been a good thing. And so I'm glad that that era is pretty much over. I don't think people use steroids as a mainline defense against Crohn's or UC.
Doctor, in several countries, they still do. They still do. It's still the first thing that comes out of a lot of doctors' mouths. So, and I know that for a fact because I've helped a lot of people with steroids. But I'm glad that that's right that you've said that. And as I said, working with your doctor is still the most of utmost important. If you have a doctor that truly cares, he will listen and he will work with you.
Oh, absolutely.
I've got a question here that I wouldn't know the answer to. Can people with gastric
Absolutely. Absolutely, they can drink Kangen water. As a matter of fact, people with achlorhydria used to drink dilute stomach acid. I mean, they used to drink hydrochloric acid like pH 2 to help their digestion, like before a meal, they'd drink some of that. Because as you know, we need acid to help with our protein and digestion. And so certainly they can drink Kangen water, absolutely. So and sometimes actually, and this is known, it doesn't happen often, but it does happen. If they drink the water regularly, the Kangen water, their achlorhydria improves in some cases.
And doctor, you're talking about just our 9.5, 8, and 8.5, right?
Right.
We're not talking about drinking the 2.5 pH water in this situation.
No. I don't think you could hurt yourself very much by having a little of it, but that's not the issue. The company makes it clear this is not a drinking water, that pH 2.5, nor is the 11.5, but people still sneak it in. We don't want to get into any controversy because clearly when you drink 2.5 water, that's powerful acid, and that can cause cellular damage in large doses.
So I like that you've said that continuous use and drinking continuously our Kangen 8.5, 9, and 9.5 actually helps rebalance the system so that it gets rid of issues like this one without the extra or the need for our 2.5 pH, because that's what the water is designed for, right? It's designed to actually teach our body how to function normally. It's designed to equip our system with the tools it needs to rebuild itself.
Well, I think that's a good way to say it. Yeah, I mean, obviously, what you're doing is by balancing the energy production in your cell and by improving that, and that's we haven't talked about that today, but we in one study showed that the mitochondrial engine of the cell is upregulated when Kangen water is ingested. So if you have a substrate like glucose, which is what we need in the cell, the Kangen water encourages the use and cranks up the energy metabolism and the output of ATP by the mitochondria. And again, that's a powerful benefit.
I love that. Doctor, I've got another question here, and I'm reading it off my phone again because it's gone to my personal page. For skin cancer, will bathing 2.5 and 11.5 water help apart from just drinking Kangen water?
No. To that question, I mean, You can do 2.5, you can do 11.5, but that's not treating a cancer. You can put that on, that's not going to treat the cancer. Skin cancers are treated by excision. You remove them. Some are treated with radiation. Some respond very well to radiation. But balancing the internal milieu of your body makes total sense whether you got a skin cancer or not, because it just does. See, but there is no therapy for skin cancers that rightly would involve the water. Now, if you've had an excision and you've got a nasty wound from it, you've got an infection, something, yeah, that'll be helpful in healing that wound, but not treat the cancer. I don't want to even get into that possibility, because people will put it on and say, gee, why didn't it get better? Well, it's not designed for that.
Awesome. I love that. Doctor, you've mentioned that you have used the 2.5 in wound healing in your practice previously. Now, sometimes when you have an incision with surgery, some people develop keloid. Is there is 2.5 or 11.5 something that you've had experience with in terms of keloid?
I have limited experience with keloids, although I've had some, and some of my own patients have developed keloids. Remember, it's a genetic predisposition that occurs in certain people more so than others, and there's some hereditary factor to it. The treatment of keloids is difficult, and it does involve some surgery. What we do is you do an intrakeloidal excision. It doesn't take away the whole keloid, but it makes it much smaller and manageable. And also injection of powerful steroids into the keloid works, but it's not popular because it hurts like hell. And so people, they have that once and then they learn to like their keloid.
Awesome. I'd just like to say thank you to everyone that's watched. Judy, Tina, thanks, Tina, I love you. Thanks, Indri. Thanks, Tamara. The other names that have popped up earlier, I'll be able to see once I go properly into all the other social media platforms. Dr. Filtzer, it's just been an amazing chat with you, and it's a great way to actually have my cup of coffee in the morning. Yeah. And before we end, I just wanted you to give us one last message, one last statement that you'd like everyone to remember. If there was anything in this whole discussion, what is the most important take you would like other people to actually remember?
Well, I think I would like for them to remember that we are on a quest, we're on a road to showing this product, this Kangen water 9.5, this ionized alkaline water, for what it truly is and what its benefits truly are. And we're showing that by doing studies appropriate to a structure function effect. Now, we've just begun, and I think there are so many other things that could be done. For example, we're talking about stem cells and the stem cell response and longevity, for example, telomere lengthening, all of those things. I firmly believe that we should address that over time, and I believe that any company that continues to do R&D on its products as a way of life will do better in the long run than not. Look at Mercedes-Benz. In 1936, they built a 4-cylinder diesel engine that in 2021 is still the world's largest automotive engine produced and the best. Why? Every year they worked on it and improved it. And every year, Enagic and companies like it ought to showcase their product by showing another health benefit that is provable and repeatable. And that's my message.
Thank you, Doctor. I love that. And for everyone that's watching here, Lai, Audrey, Rain, Michael, I missed out some names, Charlene, thank you so much. Thank you for watching us. We're very happy to be able to have sent you, given you this cuppa this morning. Hope you've enjoyed it with your cup of coffee as well. And Dr. Filtzer, thank you so much. I mean, your book, your videos, your research has actually helped me help others understand the water better. And I think what I also, if I could just reiterate some of the things that we've said today, it's we know now for a fact with Dr. Filtzer's study how amazing this water is. We now know that we actually have access to this water. Now that we know that, let's not try and, you know, do it a different way. Why do you want to try and experiment? We know what works. Let's use what works. Let's help our body rebuild itself. Let's try and live optimally. In the Anti-Aging Medicine Society, they've said that the person that's going to be living up to 125, 150 is alive now. Let's be that person if we can. Why not?
Sure.
And if that means drinking the right kind of water to optimize our health, exercising, moving right, eating right, then let's do it. There's no reason anymore to pretend that we don't have the information in front of us through the tips of our fingers, through Google, through checking the National Institute of Health. And with the information that Dr. Filtzer will send me, for any of you that want to have access to that study, please send me a message. For those of you that want the book, I will also share with you where to get that book. The book's available online. There are leaders in Singapore like Judy Fleming who's got the books available with her. Dr. Filtzer, what you've done is just amazing. What you've proven is, still blows my mind. And thank you for continuously learning more about this water to help more people. Thank you for your time today.
You're very, very welcome, and I hope you have a good day. Be well, all of you.
Thank you, Doctor. And everyone, thanks for joining me. Charlene, you are most welcome. You are most welcome. And Judy, thank you as well. Thank you for your support. You and Charlene helped me get this interview happening. And again, remember, there's no wrong or right question. If you have a question about the water, what it can do for you, please continue asking. We will answer the questions as we see them. I love the question on Crohn's and everything that you've done, Lai. I have done the same thing. Again, as I said, I did work with my doctor, and I would still recommend for others to do that. It's very difficult to just try and work on your own, implement things on your own without the support of a professional. So connect with a professional, whether it's an alternative medicine practitioner or a medical doctor. Our body is very smart. It can rebuild itself. It just needs the tools. And one of the most important tools you can give your body is the right kind of water. You're more than 75% water. Every year or every few years, that number keeps going down. And it's mostly because as we age, we dehydrate. So if good health, optimal health means being hydrated with the most antioxidant rich water, with the most energized water, then so be it. Let's do it, and let's do it together. Again, ask your questions. I will continue answering them. I will send you the study. But you know what? This book is truly amazing. I've been going through the book cover to cover for quite a while now. All the knowledge that Dr. Filtzer shares with us is in this book. And know that every time you get the book from the true distributors, the right distributors like Judy Fleming, you are helping Dr. Filtzer, Fred Brown, who helps him out as well, and the people in their group that are trying to learn more and educate people about the water. Because every amount of money that we put into this book actually helps to them continuously doing the research on the water and getting deeper into it. Remember, there's still a lot that we have seen the water do for others, but we don't really have the scientific backing. It would be great to have a backing on all of that. So let's help Dr. Filtzer continue his research. Patricia, thanks for joining us. Thank you for watching. And thank you again, everyone. Hope you enjoyed that today. Have a great day, and I hope you enjoyed your cuppa. I drank all of mine. Good morning, good afternoon, and good evening to all of you. Bye-bye.